This is Tom Lee, editor-in-chief of NEJM Catalyst, and we're talking today with Rob Allen, the president and CEO of Intermountain Health, the integrated delivery system in the inner West states, headquartered in Salt Lake City. At the JP Morgan Healthcare meeting this January, I heard Rob speak about Intermountain strategies, and he described two very interesting focuses. The first was expanding value-based care, and the second was simplifying care for patients, caregivers, and health plan members. I asked him if he would discuss them a bit further for the NEJM Catalyst audience, and he was kind enough to say yes. Rob, I think most of our audience knows something about Intermountain, but some may not have the full picture. Plus, Intermountain's changing. Can you give us a snapshot of Intermountain today?
Yeah, Tom, thank you for the opportunity to be here with you. And Intermountain Health is based in Salt Lake City, Utah, formed in 1975, and as an integrated delivery network. We have hospitals, 34 of them across a 7-state reach with nearly 400 clinics serving folks in that general area. Last year, we had about 5 million clinic visits for the population that we serve. It's about 630,000 square miles reach that we have when you look at our footprint. We have a health plan that started in 1982 called Select Health, about 1.1 million members for the health plan. And Intermountain Health is focused on care delivery and the traditional healthcare world of hospitals and clinics, but also focused on going upstream and taking care of communities. We talk a lot about social determinants of health. What are the things that make a difference in people's journey? In fact, our mission is helping people live the healthiest lives possible. And our focus, as we look to the future and around the 2 points that you've teed up that we'll talk deeper about, is really focused on that broad journey of health and well-being. In fact, our strategy has been to engage people in a value model and expand that as much as possible to support people in their journey through taking full financial and clinical risk for their health and well-being, and being here to take great care of you if you need the traditional clinical services that a hospital or clinics provide.
So it sounds like I did hear you correctly in San Francisco, and expanding value-based care really is an important strategy for you. Now, there are many organizations out there right now who say that they are retreating from value-based care. Can you explain why you and Intermountain are embracing this goal? What's making you different from the ones who are retreating?
Yeah, first I would say it's mission. Our mission, and as I just quoted, helping people live the healthiest lives possible, really demands that we look at going upstream. And the value-based care model really is two components. The first is a payment mechanism. And I think it's important to understand that piece. We often talk about it in the context of the payment mechanism, but it's much more than that. The payment mechanism itself is simply saying we'll take the financial risk, and therefore we manage the care. And if we manage it effectively and keep people healthy, the cost of care is less, and the financial side wins. There's resource freed up to go upstream. In fact, the thing I love about that payment model is it truly gives us the freedom to do the right thing. You think about the traditional fee-for-service model, we get paid in healthcare when we do something to somebody. That can be a perverse incentive. Most of the time, frankly, our caregivers across the country, I think all who are engaged in this work, are driven by pure motives and intent. But there is a perverse incentive there that sometimes leads a few off track. But even if you're driven by that pure motive of caring for people, there's no economically viable model to take care of people outside the walls of a hospital or clinic if you're in the traditional fee-for-service model. So it frees up our ability to go upstream, to focus on your health and well-being and invest in that, divert or direct resource from the traditional models into the community at large. One example of that is housing. We found that one of the key social determinants of health is access to housing for people. And we've partnered with some organizations in Utah, and we're expanding that broader across our footprint to help find or fund affordable housing units for people And we've taken part of our investment portfolio off our balance sheet and directed it into those types of investments. And so far, we've preserved or added over 2,000 housing units through those partnerships to help folks, and we'll continue to focus on that. And the value-based payment model allows us to do that. The other piece of value really is connecting the care journey. And this is the piece that gets talked about less than the financing mechanism, but it's making sure that all those players along the way, the purchasers of health insurance, the health insurance companies themselves, the clinicians delivering care, are all aligned with the patient or the community member's need to actually assure the steps along the way are managed well. And healthcare can be quite disjointed. We'll come to the complicated side of things and why simplicity is important to us. But the financing mechanism, when we look at our country's health system, is an area of great concern. And when we look at the value-based care model, we do believe it's a critical part of success in the long run. And the financial viability model itself, 27% of the 4.4 trillion we spent on healthcare in this country last year is said to have been spent on things that are preventable. So if we truly can go upstream and help people stay healthier, we free up resource in the health system that allows us to invest in the right things. It allows us to deal with the challenges we're facing in healthcare right now for organizational sustainability. And ultimately, we believe it helps us make care more affordable or more accessible to people who need the services that we do provide.
All of us have things that we want to do, and then there are things which we have to do. And the magnitude of the investments that you're describing in improving value suggests that you are feeling like this movement toward value is more in the second category, things that really you have to do to be who you are and to thrive. So as I thought about what would make you feel that way, I thought of two different possible motivations. The first is Intermountain became prominent on most radar screens for people in healthcare in the 1990s because of the work Brent James did on quality and safety. So it sounds like, in part, you might see Intermountain's commitment to value as an extension of that orientation, that this is all about making healthcare for the people in your region better, and it's a logical next thing beyond quality and safety. Another possibility that occurred to me is that you've got a big health plan, and Select Health is a very innovative, terrific health plan. But this may feel like a core business strategy because the health plan has become so important at Intermountain. So I was wondering, which is it, or is it both?
Well, in many ways, it's both, Tom. But the Brent James era was a critical era in Intermountain's evolution. I've known Brent since 1989, and I've had the joy of working with Brent over the years and learning from him. And that is a key driver. And Brent's work was built on the foundation of the organization, which, when it was organized in 1975, the charge given to the original organization was to be a model system as we serve our community. The addition of the health plan in the early 1980s was a step towards that model system, creating this structure that allowed all those pieces to come together and be aligned. Before we talked about value-based care, that was an alignment move that set the stage for this work. And then, of course, the quality work led by Dr. James and others in the organization that he worked with set a broader vision and helped us move forward. And this is definitely a continuation of all of that. And at Intermountain now in Utah, about 50% of our payment structure is under the value-based models where we take the risk. And across the organization, it's about 37% of all of the payment structures we have are under a value type model.
So that's a pretty good chunk. Now, turning to that second goal, simplifying care, it was striking when you brought it up. Over the years, I think I've heard Brent James and other leaders from Intermountain talk about making care safer and more effective and making it more efficient. But simplification was something that you really emphasized in your talk. So if you could expand on what's the problem you're trying to solve and how are you going to solve it?
Yeah, Tom, I don't think this is a surprise to anybody. Healthcare is complicated. It is a challenge. In fact, 62% of Americans say they believe that leaders us in healthcare intentionally design it to be confusing. That's a remarkable perspective. And as an industry, we need to take note of that. And when you think about all the great care, you mentioned Dr. James and the clinical quality work focused on excellence and great outcomes. Intermountain was recognized at the end of last year as one of the top 15 systems and hospitals in the country by Pink AI, doing analytical view of the outcomes of patients. And in that, they noted that if the rest of the country delivered care like Intermountain and the other 15 in this group did, last year, the year before, 207,000 lives would have been saved. Over 432,000 people would have had uncomplicated hospital stays that did have complications. And so you think of the quality of care that our teams deliver, we're proud of that. And we think that we've continued that drive to be the model and to always try and get better. That said, we know we need to get better on those fronts too. But when you look at that and you do that comparison, you could argue Intermountain gives some of the best care in the country. But Tom, that doesn't matter if you can't get into the system. And that's the case around the country. Access to care is challenging, and then figuring out how to navigate from one step to another step, extremely hard for people. It's confusing, as our communities and the country tells us. And so we think about simplification for the patient as an add-on, frankly, a critical add-on to our work around accessibility of care. We think about their journey. If we're trying to go upstream and help them stay well, we need to make it simple for them to know how to get care, when to get care, where to get care, and what the next step in their care is. And then you just move over to the caregiver. We know in this country, I mean, just look at the pandemic. Our folks have been through a lot, really tough times. They've moved from being heroes, where they were heralded as such, to almost months later, being spit on and kicked and punched in the ER because you mentioned COVID to somebody who doesn't believe the disease exists or whatever the circumstance might be. It's a very difficult environment that we're trying to assure safety. On top of that, we know we're not going to have enough doctors or nurses or other providers, techs in the future. So we're going to have to think differently about how care is delivered. And it's been projected that 25% of healthcare cost in this country is waste, that it's actually done for things that don't add value. We know that a nurse on a med-surg unit, studies show, spends about 30% of their time taking care of patients, 70% on other functions and processes. So how do we simplify their work so that it brings the joy back in? How do we use tools and technologies today? The AI and the tools coming out, I think, give us great prospects of ways to change that work to support our caregivers. All of our doctors, nurses, and others, as I talk to them, they got into healthcare for really important reasons. Sometimes that gets lost. If we can simplify, make their jobs easier and more able to do each day, not feeling overwhelmed, they can truly focus back on why they got in it. By next month, now we're rolling out right now, ambient dictation. Any physician in our system who wants the tool will have the ability to have ambient dictation in the room, and that will be up and going. And we trialed it last year, had great success. 97% of our physicians liked it. And we're excited to bring tools that doctors are telling us is life-changing. Instead of spending the evenings catching up your dictation from the day, they get done seeing patients, they actually can go home, have dinner with their family, go do their hobby, whatever it is that helps them rejuvenate for the next day. We're trialing similar type things with our nurses to make their flow easier and better and support their ability to be at the bedside with patients. Those are a couple of examples, but I think simplification is something that, it's not the sexy stuff. It's hard work, but it is critical to our ability to have a model that's sustainable, that allows our caregivers to do what they're here to do, that allows our communities to actually get the care we're here that we give. Even when we're great at it, we need to be better at their ability to get into those services. And I'm excited about the journey we're on.
Well, I always wonder, who are those 3% of doctors who don't like the ambient AI approach? But that is related to the question of how are you going to be able to tell whether you're succeeding on this work to simplify care? Because I'm sure those 3% will be complaining to you, and part of your workday will be tied up with that.
Tom, it really is about, are we meeting people where they are? And, we talk about personalized care, and with genetics and those types of things that we now can personalize your journey based on your risks. those are things we need to think about in every step of what we do. And the 3% of doctors who didn't like it, it's a training process, and they didn't like the training process. And that's not where they were. They weren't in a space where the training is worth the time up front to train the tools to get the benefit on the other end. And so we want to respect that as well. We don't want to force the use of the tool. We want to make it available and let people use it where they're at. And I think as we look at these other steps along the way, that's going to be an important part of it as well. Are we successful? There's a number of metrics. Are we able to lessen the nurse turnover, the physician turnover, the tech turnover in our organizations? By the way, our nursing turnover is dramatically lower than the national average right now. We're doing some good things there that we're happy about, but we need to do more. Are we able to actually impact the cost of care? Are we able to actually staff our units and our services in the future as the labor market gets tighter? Those will be key checkpoints for us if we're succeeding in this journey. And I believe that we can. And by the way, you look at that 25% of savings on the simplification side and the 27% potential savings by going upstream, that's 52% of the healthcare spend in this country has the possibility of being saved, redirected, reinvested, and creating space for the needs we have today in healthcare. And I love the promise of that. So we have a lot of work to do, and it's going to be a journey ahead, but we're committed to that journey because we think it provides the answers to the challenges we face.
I really like your response, particularly regarding the 3%, because we do have a tendency in healthcare delivery organizations to get paralyzed by exceptions. And we can't move ahead until we have unanimity. And obviously, if we have that philosophy, we'll never move ahead at all. So I think meeting people where they are, it is the right response. But let me ask one more question before we close. Again, stimulated by your JP Morgan presentation. You talked about Intermountain forming multiple important partnerships with UC Health, for example. That kind of complexity can be distracting, particularly when you're trying to pursue simplification. What's driving you to pursue these relationships when there are these other challenges right in front of you?
Yeah, a couple of things, Tom, when you think about drivers behind this. The first is, frankly, we cannot do everything on our own. And so it's the recognition that in healthcare of the future, we need to come together in meaningful partnerships and bring strength together to serve better those who count on us. So that's an underlying premise for us as we look at this. Now, 2 years ago this month, we merged with SCL Health based in Broomfield, Colorado, the greater Denver area, with hospitals in Montana and Colorado. And as we completed that merger, we looked at what are our options to expand value-based care in Colorado, particularly in the Denver area. And we, through that process, came together with UC Health, who also had great interest in expanding value-based care, to create a network, a clinically integrated network of physicians between our organizations that provide a broad span of access points with a common drive to create value for our communities in a meaningful way, and an avenue to bring our insurance company to the greater Denver area in Colorado in order to facilitate that work. And so we came together for that purpose. And Tom, we see this as a way, and yes, every move can have complication, can add work, could it be a distraction, but we see this core to our work of expanding value-based care. And in the process, we believe it will enhance what we can offer to the populace we serve. And in this partnership, I believe UC Health sees that opportunity as well. We certainly believe that that will enable their ability to also enhance what they offer to the population that they serve. So that's the driver behind it. And we very optimistic. It's just underway. We started selling insurance last fall, and we exceeded our enrollment goals to start the year, but it's the first year into it. And so lots ahead of us, and excited to see that grow and develop and bring value to the Colorado and the greater Denver market.
Rob, I want to thank you for your time. I can tell you that for the last decade, that when people ask me who's interesting, I always list Intermountain among the top 5 because of the creativity and the effectiveness. The 3 themes that you hit on make me confident that you're going to continue to be there for the next several years. Your your orientation toward value-based care, your pursuit of the goal of simplification, and your readiness to develop partnerships so you can extend your reach and to get functionality you might not have now. Those are probably three very important focuses that not every delivery system out there has. So we'll be following along quite carefully, and I'm sure that you'll have insights to share with our audience again in the future if we can get on your schedule. Thank you so much.
My pleasure to be with you. Thanks for the opportunity.